Craniectomy Brain Surgery, a 3D educational journey. In the world of neurosurgery, precision and speed often mean the difference between life and death. Among the many procedures designed to protect the brain, the craniectomy stands out as one of the most dramatic. In this educational video, brought to life with advanced 3D animation, we will explore this life-saving surgery step by step. From the structure of the human skull to the meticulous steps inside the operating room, this journey will help you understand what happens when surgeons perform a craniectomy and why it is often the last line of defense against catastrophic brain injury. Anatomy and physiology. To understand this procedure, we first need to explore the anatomy. The brain is protected by the skull, a rigid bony structure made up of multiple plates fused together. Beneath the skull lies the dura mater, a tough leathery membrane, followed by the arachnoid and pia mater, which together cushion and protect the brain. The brain's blood supply comes from large arteries that branch into a vast network of vessels, ensuring oxygen and nutrients reach every cell. But this closed environment has a drawback. If the brain swells, there's no room for expansion. Pressure builds, compressing delicate tissue and blood vessels. Why a craniectomy is needed. When head trauma, stroke, or infection causes the brain to swill, pressure inside the skull, known as intracranial pressure, rises to dangerous levels. If untreated, this can cut off blood flow, leading to permanent damage or death. In these moments, doctors may decide to perform a craniectomy. By removing part of the skull, they give the brain space to swell safely, preventing further injury. Preoperative preparation. Before surgery begins, patients undergo rapid imaging, usually a CT scan, to identify swelling, bleeding, or clots. The surgical team reviews the scans, plans the incision site, and prepares specialized instruments. The patient is intubated under general anesthesia. The head is carefully positioned and secured to keep it absolutely still throughout the operation. Surgical instruments. Neurosurgeons rely on a precise set of tools: scalpels for incisions, retractors to hold tissue aside, high-speed drills to cut bone, and bipolar cautery to control bleeding. Each instrument plays a critical role in ensuring the patient's safety. Step-by-step procedure. The operation begins with a careful incision through the scalp. The skin and underlying tissues are reflected back to expose the skull. Using a high-speed cranial drill, the surgeon creates small openings called burr holes. These are connected with a special saw to remove a section of bone, the bone flap. This piece will be stored for later replacement, often in a sterile freezer or even the patient's own abdomen to keep it viable. With the bone removed, the dura mater is now visible. In many cases, the dura is opened to further relieve pressure and allow the swollen brain to expand safely. This decompressive phase is the critical life-saving moment. By removing the rigid barrier of the skull, surgeons create space for the brain, reducing intracranial pressure and restoring blood flow. Dural closure and temporary protection. The dura may be closed loosely or left partially open depending on swelling. A synthetic patch or protective layer is often placed to shield the brain before the skin is closed. Unlike a craniotomy, the bone flap is not replaced immediately. This leaves a temporary soft spot on the skull, which will be repaired in a later surgery called cranioplasty. Postoperative care. After surgery, patients are transferred to the intensive care unit. Intracranial pressure, oxygen levels, and vital signs are monitored closely. The goal is to ensure brain swelling subsides and the patient stabilizes. Risks and complications. Like any major surgery, craniectomy carries risks of bleeding, infection, seizures, or fluid buildup around the brain. Meticulous surgical technique and modern critical care help minimize these complications. Once swelling resolves, often weeks or months later, surgeons perform a cranioplasty to replace the bone flap or insert a custom implant. This restores both skull integrity and appearance. Recovery and rehabilitation. Recovery involves physical therapy, speech therapy, and sometimes occupational therapy. Many patients regain significant function, though outcomes vary depending on the initial injury. Conclusion and recap. Craniectomy is a powerful surgical tool, one that turns the tide in life-threatening situations. From the operating room to the rehabilitation center, it represents the intersection of surgical skill, medical technology, and the resilience of the human body.